And good morning, Montrose. I'm Tonya Maddox, and I'm the publisher of the Montrose Daily Press. And in the MDP studios, we have Dr. Adragna from Peak Professionals. All right, he's already had me cracking up just a little bit, so we're going to have to ask about his coffee intake soon. But before we get to that, I wanted to thank Elevate Fiber for sponsoring Montrose Matters and bringing Dr. Adragna here with us today. So thank you so much, Elevate Fiber. All right, Doc. Coffee or water, which is better?
Everything in moderation. You got to have a balance.
So,
now that we're on camera.
Yes, now it gets serious here. No, but I learned something during our quick little chat. Water can kill you too much, right?
Yeah, it's very rare, and we're not encouraging you not to consume your healthy amount of water. But if you consume too much water without any electrolytes, then it can actually lower your electrolyte levels. So everything in moderation. You need your water. Coffee is also okay, especially if you're in the healthcare profession. We tend to overdo it sometimes. But,
just a little bit,
yeah,
right?
That's right.
You had to make it through medical school some sort of way.
That's right. I was in a cardiology consult rotation one time, and I was competing with the fellow on how much coffee we would consume in a day. I was doing a thermos, which was about 600-700 milligrams of caffeine a day.
Oh my
He was
gosh.
doing 1,000 milligrams a day, but he was working a little bit more than I was at the time. So I give him a little credit for that.
Hey, you know what? You have an interesting story, and I love that you are a homegrown boy, aren't you?
That's right.
You're from Montrose.
That's right.
And you met your wife here, and she's from Olathe.
That's right.
And then you decided after medical school you were going to come back and practice here. So just give us a little bit about your background and your history. One,
Sure.
did you always know you wanted to be a doctor?
Yeah, so I always knew I wanted to be a doctor since the age of 5. I was exposed to healthcare at that time as my mother went through a breast cancer treatment, and she's still with us today, and she beat it, but she was a young lady at the time, and I remember going to the hospital and helping to remove fluid from drains that were coming out of her chest after surgical procedures. And then what really impressed me was the amount of respect that my mother showed for healthcare professionals, nurses and doctors, and she absolutely revered them and credited them with saving her life. And so growing up with that level of appreciation and the interest that I had in academics was a good mix. And so in high school, I started shadowing some of our local family doctors, and that just flourished my interest. I went then and did an EMT training program during my senior year of high school and finished that. I couldn't get licensed until I was 18, so once I turned 18, I got the licensure done. It took me about a year to get employed. Eventually in Grand Junction, I got employed on an ambulance company, and one of the private ones there called AMR at the time. And then they lost the city contract, so I went over to the Grand Junction Fire Department, worked with them for a few years while I finished up college, and then went to medical school. But back in high school, I made a pact with my now wife, at that time just someone that walked through the drive-thru at Taco Bell when I was working.
Wait, the Taco Bell on Townsend.
The Taco Bell in Townsend, yeah. So I worked there in high school, and she came walking through one evening with her friends, and I thought she was pretty good looking. So after several months, she allowed me to take her out on a date.
Okay.
Somewhat reluctantly, I felt like. But eventually.
Good for you.
Yeah. Eventually, though, she couldn't resist my charm.
Oh,
Yeah. And so we made a pact. She said, look, if you agree to go to whatever college I go to, I'll agree to go to whatever medical school you get accepted to. And later she admitted that she didn't think I was going to get into medical school. So it eventually worked out, and I got accepted to CU Medical School after I finished my college at Mesa State College at that time, now CMU. And she got accepted to DU, so we just continued our training together, and it took both of us 11 years to complete that journey to getting our professional training done.
That's an amazing story. You know what there are so many points that I like about it. And your wife's name is Dory, right?
That's right.
Okay. Dory, you're already one of my favorites, okay? But what I like about that story is you had a plan. You had a plan early on, and you took it upon yourself to make it happen by shadowing and so forth. We had a young lady just in last week who wants to be a journalist, and she came and shadowed us, and it was eye-opening for her, and I believe that she'll be probably one of the best journalists in the business, a couple of years from now. But with all of that said, you wanted to make Montrose your home. So you guys, you've finished school, undergrad, medical school, and so forth. You got married during all of that, and you have a little one, don't you?
That's right. So all the credit to my wonderful wife. We decided that the last year of our training would be the time for her to become pregnant, and so July 14th, She delivered our now 3-year-old baby, Amelia, and that's on Dory's birthday. So they share the same birthday.
Okay, you two are the ultimate planners, all right? Oh my, God help us all, right?
Yeah.
So, all right, so we have this new family, and you decide that you want to come back to Montrose. Tell us what you love about Montrose.
Montrose is a wonderful place for community. This is exactly where I want to raise a child and have a family. It's got a great community sense. It's got tons of activities to do. You can never have trouble finding something to do here with all the wonderful outdoors activities. And then the medical community here is really solid. We've got a ton of resources in this small town that rival any of our competitors, if you want to use that language, in big cities. We sometimes hear people say, I've got to go to Mayo or I've got to go to university for these care items. And the reality is oftentimes you don't. And our technicians, our surgeons, our family doctors here in town trained at all those places you want to go to, and they're bringing that level of care here to Montrose.
And we are so blessed to have that level of care here. We're going to take a quick break, and when we come back, I'm going to get some free medical advice from Dr. Adragna.
Here in the heart of beautiful western Colorado, known for its unrivaled outdoor recreation, bountiful harvests, and unparalleled quality of life, changes are being made. Elevate Fiber is transforming the way we work, live, and play by creating exciting new opportunities for local families and businesses. Are you ready?
And good morning. Welcome back to Montrose Matters. I'm Tonya, Maddox, and in the MDP studios, we have Dr. Adragna. All right, I tried to steal his coat during the break, but he told me he had to work 11 years for that, so I'm not getting my hands on it. But that's okay. I'm going to get some free advice from you because, you know, there are some unique things that you all are doing at Peak Professionals. And I know I should just go in there, but I figured I'd use the show to get some free advice. Sure. I'm kidding. No, but seriously, Peak Professionals is a unique practice, not just for Montrose, but in general. Can you tell me a little bit about your practice?
Sure. So I've always believed that integration of healthcare services is going to be better for you as a patient. Okay. You know, it just seems unusual to me that you come to your doctor and we say you need lab work done, so go to the hospital for that, and you need a prescription, so go to your pharmacy for that, and I need an x-ray, so go down to the x-ray suite, and I need you to see a consultant, so those guys are in the next town. Right. So if we can bring that into one, call it a home, then you're going to have more access, streamlined care, less error rates, faster service. Okay. And so at Peak Professionals, which is our management entity, we integrate 4 different specialties now, and it's growing. So we have our family medicine division, we've got chiropractic, pediatric psychology, and we work with our urologist in town. And we all share the same processes, systems, and EMR, so that when I refer you to the urologist, we can actually schedule you right out of our office. And they have instant access then to your records. Okay. If you need to see our chiropractor, we can schedule that as well on your way out from your medical visit, or sometimes even receive services right then and there when you see me as the family doctor.
Do you believe that that process makes it less daunting for people, that the individual are more likely to go, to their doctor's appointments and see if they're not, hopping all over town and having to do all of these follow-ups?
I do. I think that healthcare in general has a record of very poor customer service. Everything I just described does not sound like a customer-focused industry, does it? And so I think that when we offer a higher level of service, people will access that care, that service that they need, and then we can catch things earlier and prevent diseases from getting out of control or the complications of uncontrolled diseases.
So if you couple that with your community focus that the practice has and high integrity, I mean, that sounds like, that's a darn fantastic practice to me. That sounds like all of the things that a community such as Montrose needs. Why did it take so long? Why do you think? Yeah, so
that's a very good question. So Montrose struggled. Before I came here, I believe there was 5 to 6 family doctors that had left practice in the preceding just few years when I started here in 2015. And I believe that was because most doctors have no business training. And so knowing that, my mentor here in Montrose in high school told me, if this is what you want to do, you need business training, and you're not going to get it in medical school. So between college and medical school, I attended graduate school and got 2 advanced degrees in business. Okay. That allowed me to simply plan. It's not rocket science, actually, to make a business plan. You just need to take the time to do it, and then ask a lot of questions of people that know more than you. So you get a business plan put together, and you bring it to Montrose, and it has worked. And I think planning has been part of our success, but also being able to meet the community's needs. When I came to Montrose initially, a lot of my colleagues screened applicants to their practice. You had to apply to be a patient. I'd never heard of that. That was not seen in any of the training institutions I went to. If you wanted to be a patient at a place, you could schedule an appointment and meet the provider and see if it was a good fit. If at that point it was determined it wasn't a good fit, well, then maybe you move on or find somebody else that works better for you. For us, we opened our doors and we were unrestricted, essentially. So in our first month of being in Montrose, we had 600 people attempting to get into our practice. Yeah, and we completed 330 visits in our first month of practice, and then we grew. We grew to meet the need of the community, and we knew we were going to do that because it was in the business plan. Right. So we added 3 new providers within that first year. So it grew from just myself to 4 providers within 12 months, and now we're up to 10.
So, there's a play on words with your family practice. Mm-hmm. If I walked into Peak Professionals today, who would I see?
That's a great question. So you may meet my mother.
Yes.
So she works in the office. My father does bookkeeping part-time. And my twin brother actually is in charge of our business development.
Wait, there's another one of you running around Montrose? Are you kidding?
There is.
Okay.
Yeah, he'll say he's better looking. He's not an identical twin, so you won't be able to pick him out of the crowd. But he's a great guy, and he with his passion and his ability to do things I can't do, have been able to propel us to meet the community need in a better way.
That's wonderful. So every now and then will we see that little lovely lady running around there too?
Yes, so Amelia comes to the office every once in a while, and there's tons of toys everywhere in our office because Dr. Dory does pediatric psychology, so she has to keep children entertained all day long. Okay. So Amelia loves it. It's like a playhouse.
I love that. Well, maybe I need to get my 5-year-old and head on down to see you guys. We're going to take another quick break, but when I come back, I am going to tell you that you're going to be so enamored with the information Dr. Adragna is going to give you about the importance of annuals that you're just going to want to get a colonoscopy and things like that right away, right?
That's right.
We'll be right back. And welcome back to Montrose Matters. I'm Tonya Maddox, and in the MDP studios, we have Dr. Adragna. He has not run out yet. I have tried. I did get some free advice on the last break, though. But anyway, Dr. Adragna, what are you the most passionate about besides your amazing practice and your lovely family? What keeps you up at night? What are you concerned about? What do you get excited about? And what's your hope for the future?
Thank you. I think that the number one thing that gets me excited is system building. I love the idea of coming to Montrose and saying there's a primary care shortage problem. How can we fix that? And then develop the way to make a successful story that saves thousands of people from going without a primary care provider. We've done that at Peak, and I want to keep doing that, and we're going to do it for as long as I can practice. Besides that, from a clinical perspective, a patient-to-patient matter, the most important thing to me is to make the right diagnosis. Oh, okay. I am very keen on that. I think if we're steering your healthcare ship, we better be steering in the right direction. And I can't do that unless I know what I'm treating. Mm-hmm. So we focus on making sure that you have the appropriate diagnostic studies, the appropriate workup, and we listen. You know, they taught us in medical school that if you just listen to your patient, you can get the diagnosis right, usually 75 to 85% of the time. And I have found that to be true every year of training and every year of practice.
Well, there's, I like that. You're absolutely right. And I don't like to be listened to at all, so, that doesn't appeal to me. But no, in all seriousness, there's a shortage here of folks, or a limited number of people who are getting annuals. Why is that?
That's right. I think that's a public health concern that we should all be talking to our friends and neighbors about. annuals are important. Annual exams they go by other names, wellness exams, preventative exams, all of that. But what I'll encourage you all as viewers of this channel to do is go to your doctor and say, I want a preventative healthcare exam, an annual, a wellness exam, whatever you want to call it, and say, doctor, all I want to do is talk to you about how to keep myself healthy and do whatever screening is appropriate to prevent or catch an early diagnosis of something that might harm me. Not use it as a visit to deal with your chronic illnesses or your acute problem. And we see that a lot. People come in, they don't really know what an annual is supposed to be. And so they say, here's my laundry list of things I've saved up for the last year. I've got 20 things to talk about. I know that we have 20 minutes. And you go, and as the doctor, like, oh man, I don't know if I can address 20 things today that are all new or maybe old to me. And also make sure that your preventative health care is taken care of. Because if you do preventative health care right, it takes 20 minutes, it takes 15 minutes, it takes 30 minutes sometimes for certain patients, because we look for so many things. What's your cardiovascular disease risk factors? Is it smoking, high cholesterol, blood pressure? Are you depressed? Are you drinking too much alcohol? Are you starting to experiment with substances maybe that you shouldn't? Are you at risk for sexually transmitted infections? How about screening for cervical cancer, breast cancer screening, colon cancer screening? Should we talk about skin cancer? Are you high risk for that in your family? In Colorado, we get a lot of sun exposure, so wear your sunscreen, but also, look at your skin and make sure that you're not growing new things that shouldn't be there.
You know, I had one of my doctors remind me, she says, Tonya, remember, you're black. I'm like, what? Are you serious? And that, but because of that race, I have a high risk for cholesterol and things like that. And so those annuals are important, or those preventative measures. But what's the best? You know that saying, you don't know what you don't know.
Right.
So I just had a big birthday on Friday, and there are tests and things that you should have as you age. What's the best way of figuring out when it's time to either, if you're a female, have a mammogram, a colonoscopy, you know, those types of things that don't happen during regular annuals?
That's a great question. I'll give you two options. One is the American Academy of Family Physicians website, AAFP. If you just Google American Academy of Family Physicians, they have a wonderful treasure trove of resources for both your provider and yourself and your family members. If you want a different option, the United States Preventative Services Task Force, I'll say that again, United States Preventative Services Task Force, is a group of folks that are stretched from around the country that are brought together, and a lot of times they're not specialists or sometimes not even physicians, but they're epidemiologists, they're public health experts, they're researchers, and they look at the evidence around preventative health care measures, and then they make recommendations about whether you should have that done or not. And so this group, USPSTF, has been in the news recently for their recommendations about breast cancer screening and prostate cancer screening, and there's been some controversy, but these folks are not supposed to be making their decisions based on political pressure, but rather evidence. And so if you want, just schedule a visit with your provider, and we can go through that data with you. If you want to do some reading on your own, then check out AFP or the USPSTF.
Great. Well, we can't thank you enough, Dr. Adragna, for coming into the MDP studios. It's been fun speaking with you, but it's also been very informative. And on behalf of all of Montrose, welcome back, and thank you for doing what you do here.
Thank you so much.
You're welcome.